Hello, and thank you for taking the time to look at my poster presentation. I am Michelle Thomson and a master's student at the University of Adelaide. And today I'm going to be talking to you about my systematic review on pre-hospital pain management clinical practice guidelines, or CPGs, used by paramedics. So why is this important? Well, firstly, pain is a common reason for patients to seek ambulance services, with up to 65% of patients experiencing moderate to severe pain. Pain is a global problem, especially affecting those lower socioeconomic groups. Now, while ambulance services often respond to acute pain, we now know that poorly managed acute pain can lead to chronic pain, and chronic pain affects up to 80% of Australians. As a result, paramedics frequently also deal with patients experiencing exacerbations of chronic pain. Recent research indicates that paramedics often lack an understanding of chronic pain management. So the clinical practice guideline problem. Pre-hospital clinicians rely on CPGs to manage clinical situations, including pain. However, there is a lot of difference in scope and purpose of guidelines, leading to variations in care. Additionally, not all organizations use rigorous, evidence-based methods when developing CPGs, which we know can result in unreliable or misleading guidelines. So this review has two main objectives. One, to identify pre-hospital pain management CPGs and recommendations suitable to paramedic practice. Two, to assess the quality of these CPGs and the recommendations within those CPGs. So methodology. We used a combination of methodologies. We used the JBI scoping review methodology for our literature search. We conducted an extensive search of both published and unpublished literature, and this resulted in 25 CPGs being included from various countries. For inclusion and exclusion criteria, we used the study-specific criteria discussed by Thomson et al., the PICAR framework, in line, and you'll see that on the poster, outlined on the poster. And then we also used JBI umbrella review methodology. We used the assessment part of this where we assessed the methodological quality of the CPGs and their recommendations using the widely accepted assessment tools agreed to for CPGs and agree-recs for the recommendations. So what was our findings? Our findings revealed significant variation. 8 out of the 25 CPGs scored above 50% of the total agreed to score, while 17 scored below 35%. The quality of CPGs is crucial when adopting or adapting recommendations. Specifically, Domain 3, rigor of development, when you're looking at the agreed to tool, is linked to higher quality. Yet, our findings show that only 6 out of the 25 CPGs scored above 60% in this domain. Only 9 CPGs reported the strength or certainty of evidence, and 6 CPGs reported the strength of the recommendations within the CPG. So that's the CPG findings. Regarding the recommendation characteristics, you'll see our findings there. We extracted 575 recommendations from the 25 guidelines, and of those recommendations, 401 related to pharmacological recommendations. Of the pharmacological, 143 was the highest number that related specifically to opiate-specific recommendations. Other characteristics of interest were 139 acute pain-specific recommendations and only 26 chronic pain-specific recommendations. And the in-between of that number, making up that 575, were recommendations that related to both acute and chronic. So this study underscores the notable variation in quality and methodology amongst pre-hospital pain clinical practice guidelines. By addressing these discrepancies, we can enhance the reliability and clinical usefulness of these guidelines. Establishing global standards for guideline development in pre-hospital care is crucial for achieving better patient outcomes and promoting evidence-based healthcare. Thanks for your attention.